Impacted wisdom teeth are wisdom teeth that do not fully erupt into the mouth because of blockage from other teeth, and this can cause pain, infection, or damage to the other teeth. Dr. Graves from Amarillo Oral and Maxillofacial Surgery is in with us to talk more about why we get them and when should we have them taken out. Okay, let's start with why do we get them in the first place?
You know, if you look back at if we want to think of this like a history lesson real quick, right? We look back at history, thousands of years ago, people didn't have impacted wisdom teeth. You know, thousands of years ago, our jaws were big enough to support all our teeth, and it was rarely that your teeth were crowded. So, you know, you're going through ortho right now. You know, thousands of years ago, people wouldn't have needed orthodontics because their mouths were larger and they had no crowding. The reason we have impacted wisdom teeth is really our own fault. It has to do with farming and having the diets change through time. So if you look back through like the hunter-gatherers in the old days, so you ate mostly like nuts and meat and things like that, right? So that stress caused your jaw to grow larger. And as our diets changed with farming and we started getting more refined diets, it took less energy to kind of chew this food, so your jaw grew less and then you had less space for your teeth.
So we began to evolve and we didn't need all the, we didn't need it all.
Yeah, your jaws change, but your teeth don't change. So the teeth have always been the same size, just the jaws have gotten smaller. And if you look at studies, they've done studies of tribes in Africa that are still kind of hunter-gatherers. If you look at those tribes, one thing that they noticed right off the bat was these people had very large jaws, and nobody really had impacted wisdom teeth, and everybody's upper and lower jaw was in a pretty good relationship with each other, and there wasn't much crowding.
But we've got issues. I've had mine taken out. So at what point do we know, all right, now you need to take them out. You need to get those wisdom teeth out of there.
You know, about 85% of people, mouths aren't large enough for wisdom teeth. So of those 85%, you know, typically we like to take wisdom teeth out when people are somewhere between 14 and 18 years of age. And it's more based on the tooth more so than the age. However, you know, with the roots of the tooth are about a half to 3/4 formed is about the time I like to take those out. That just reduces the risk. And when you go to your dentist or oral surgeon, they talk about a lot of different things like the nerve and different things that during the consult. All those complications are reduced the younger you are when you have the surgery.
So it's a lot less stressful on the body if we get them done earlier in those teen years.
Exactly. And the complications a lot less. And I mean, as you know, as we get older, just everyday activity, sports, as you age, it takes longer to recover from these type of activities, right?
Yeah.
It's the same way with having your wisdom teeth out. You know, I can take wisdom teeth on someone who is maybe 15, and the average recovery is maybe 2 or 3 days. I do the exact same surgery on someone who's 45. I mean, maybe a week for them to recover from their teeth.
And that's where the teeth have already come in and they're getting crowding and
or they're completely sideways and we have to cut them out just like we would if they were 15.
Wow. Okay, so we've got, obviously you do the surgeries all over the place because we see it on Snapchat. That's some entertaining. And if you guys haven't gone over to check out their Snapchat, how many followers do you guys have now?
You know, we have anywhere between 30,000 and 40,000 followers. I mean, we have followers from all over the world, and we'll have contests on our Snapchat. We'll have a contest, and I'll do like a surgery case or a pathology case, and we'll say, tell us what this is, and you'll win a T-shirt. And we've shipped T-shirts to Thailand, Venezuela, Egypt, China, and typically what I'll do is I'll translate the T-shirt into whatever their language is.
That's great. All right, so where do we need to go if we're thinking about getting a consult, or because we know that it's a pretty big deal. And one of the things that I want to brag on you in terms of the opioids, you guys are opioid free on the wisdom teeth.
Yes, and 90% of the opioids free. I mean, there are exceptions where people
if it's just too much where they need it.
Need a little bit more, but yeah, 90% of the patients we go opioid free on.
It's impressive. AmarilloOralSurgery.com. That's where you can go to get more information. Dr. Graves, always good to catch up with you.
Thank you.
Thank you, sir. Coming up, we're going to take a look at news and weather headlines. Don't go anywhere.